how does the spine become misaligned? Trauma, car accident, what else? Football, we know that. Monkey bars, we know that. I think he's kicking on you guys. So, how about birth? I'm not going to try and gross you out, but I do want to cover this. You okay? You're not going to get nauseous on me. Right? We had one woman that had to lay down one time. And the point of this is, if you watch the birth process, I won't leave it up there, but if you watch the birth process, I've had 4 kids, so I've watched it. You know, there's a lot of pulling. And my first 2 kids, we had at the Bryn Mawr Birth Center, and the midwife was great. And the thing that was interesting is I told them, I said, look, I really don't want a lot of pulling. Let's try to not pull if we don't have to. And they started to, right away. As soon as the head pops out, they start pulling and cranking on the neck to turn the baby so that the shoulders can come out. And so there's a lot of pulling. You think about a newborn infant in a crib. What's the #1 thing when you pick that infant up that you have to be cautious of? Why? Because it's floppy. It's weak. A little infant's neck is this big around and it's floppy. So you really want to be cautious of that. So if you, in the birth process, they can use as much as 90 pounds of pressure to deliver the baby. If we put a 90-pound dumbbell on the floor, think about how much pull it would take to lift that up. It's a lot of pull. And then you have forceps delivery, which can really traumatize the neck. The other thing, this is most commonly used now to assist, is the vacuum extraction. It's basically a suction cup that's put on the head, and they pull, and the kid's born with a cone head a lot of times. And then C-section, a lot of times C-section, they don't make a big giant incision and then just pull the baby right out. It's usually small, and there's could be a lot of pulling that happens there as well. And I'm not trying to gross you out with these, but I think if you think about this, if you take a baby and they're pinned in with their shoulders and you're cranking on the neck, do you think you could misalign the neck? Absolutely. The most common misalignment you'll find in infants is, where do you think it is? It's in the neck. It's in the upper part of the neck. It's very common.